Hello, this is Dr. Brooke Patterson, and this lecture is on communication and the health history. Interviewing is the best chance to gain an understanding of the patient's beliefs, their concerns, and their perception of their own individual health state. This information can vary greatly between patients. Interviewing also allows for the compilation of subjective and objective data. You can also distinguish factors such as a patient's orientation, physical appearance, posture, conversational abilities, and overall demeanor. It is an opportunity for observation and gathering information. When we talk about successful interview characteristics, we need to think about gathering accurate health information, establishing trust, teaching, building rapport, and the discussion of health promotion and disease prevention. There are different types of communication when interacting with patients. There is both verbal and nonverbal communication. Verbal communication refers to the words you speak and also your tone in the conversation. Nonverbal communication refers mostly to body language. It is very important to be aware of both verbal and nonverbal communication to help gain an accurate picture of the patient's health status and establish trust. The environment is also an important process of communication. It is important to ensure privacy, avoid interruptions, establish equal status seating, appear comfortable, and keep note-taking to a minimum. Equal status seating refers to sitting with your patient or being on the same level. Standing over patients may make them feel intimidated and uncomfortable. It is also important not to focus so much on charting and the computer. This may make the patient feel like you are not listening to them. The electronic health record is important because it improves patient quality and safety and allows you to capture important information. However, it does not always allow you to capture emotional or psychological information and can be a communication barrier in provider-patient relationships. As I mentioned before, please do not allow the computer to become a barrier in the communication process. I want to discuss the 10 traps of interviewing: providing false assurance, giving unwanted advice, using authority, using avoidance language, engaging in distancing, using professional jargon or medical terms the patient cannot understand, using leading or biased questions, talking too much, interrupting the patient, and using why questions. It is important to use open-ended questions when communicating with patients. Let's talk about the importance of obtaining a health history. It contains both subjective and objective data from the physical exam and laboratory studies. It provides a complete picture of the patient's past and present health status. It can be used as a screening tool for the detection of any abnormalities. It can be on a printed or electronic format. The sequence of the health history may vary in terms of information obtained, and the focus may differ in terms of a clinical practice setting or the nature of the complaint. The health history sequence generally involves the following: biographic data, source of history, reason for seeking care, history of present illness, past health history, family history, review of systems, which is subjective, and a functional assessment including activities of daily living. Biographic data includes patient demographics such as name, address and phone number, age, birthday and birthplace, gender, race and ethnic origin, occupation, and primary language. The source of the history is who furnishes the information, who is usually the person, although the source may be a relative or friend, especially in cases where the patient may not be able to speak. It is very important to judge the reliability of the informant. Reliability leads to the consistency of information. It is also important to note any special circumstances, such as the use of an interpreter. The reason for seeking care should be a brief statement in the person's own words describing the reason for the visit. The statement should be patient-focused and may include subjective and objective data. For example, chief complaint, headache lasting for 7 days, worsening cough and shortness of breath. The history of present illness includes specific characteristics. We will learn about an acronym called OLCARTS that will help you remember the critical characteristics. These characteristics need to be both valid and reliable. The critical characteristics include the location, quality, the severity, timing, setting and location, aggravating or relieving factors, any other associated symptoms, and the patient's perception. The question asks the following. Which of the following is a good example of a well-written chief complaint? Number 1, patient complaining of chest pain for about 3 days that is worse with activity and relieved with rest. Number 2, pain is a 10 out of 10. Number 3, patient complaining of chest pain. Rule out MI. Number 4, patient states, I don't know what this pain is. This is the worst I have ever felt. The correct answer is 1. It provides a well-described clinical symptom with precipitating and alleviating factors. Option 2 provides a numerical answer which indirectly uses a scale but has no criteria in terms of actual scale parameters. Option 3 not only provides a clinical symptom, but also includes a medical diagnostic statement. Option 4 only provides a patient's self-reported quote with no additional information related to symptoms or signs or duration. The past medical history will include childhood illnesses, accidents or injuries, serious or chronic illnesses, hospitalizations, and operations. The purpose of the review of systems is to evaluate past and present states of each body system. It takes on a cephalocaudal approach organized from head to toe. For the review of systems, you will use language to facilitate communication. The review of systems includes subjective data only. Do not include objective data. It is based on the patient statements. Include all relevant body systems. For the functional assessment, you will focus on self-care activities such as activities of daily living as they relate to general health status. You will monitor and assess for changes over time. Relevant data related to lifestyle and type of living environment may include sensitive topics that may require privacy concerns. Different types of screening tools may provide more objective validation of information with regard to substance and/or alcohol abuse.